morning to you. Treating obesity with weight loss drugs under Medicare and Medicaid is off the table. The Centers for Medicare and Medicaid Services recently making the announcement stating Ozempic and Wegovy will not be covered for people just simply wanting to lose weight. Recent studies have shown the benefits of taking GLP-1s other than just weight loss. It's been linked to lowering the risks of heart disease, sleep apnea, as well as developing Alzheimer's. The downfall, these drugs are not cheap. And now a new trend is emerging on social media, microdosing these drugs. Joining us now is one of my favorite wellness influencers, fitness and life coach Chalene Johnson, also the host of the podcast, The Chalene Show. Good morning, Chalene. Great to see you again.
Good morning. Great to see you too.
So I follow you, and on your page, this is what made me want to do this because I've been hearing about it. What are the benefits to microdosing Ozempic? And, you know, when I see this and I see it coming from you, a wellness influencer, I'm thinking, no, it's diet and exercise. So explain.
Well, first of all, I think that there has been so much villainizing of this solution for many people. And I think for some reason, this really gets people irritated, makes them angry. They will accuse people who are using the drug of cheating. But frankly, it's a hormone. And we certainly wouldn't villainize a woman if her estrogen was in decline or progesterone in decline and she wanted to supplement in such a way. I think microdosing, it is something that we need to talk about because it is a very important tool, not only for weight loss, weight maintenance, but also in reducing inflammatory markers.
All right. And there isn't a lot of research yet on the benefits or side effects of microdosing these GLP-1 drugs. What do you advise your listeners regarding the research?
Don't do this quickly. This is something that you should, just like anything else, make sure you've got all the information, work with a provider who actually has some knowledge in this area, specializes in treating people in this area, so that you understand that this may not be a quick solution, but this is definitely an option to consider in your toolbox.
Right. And, you know, I'm a fitness trainer myself. We've got a picture we can show. Your program, Turbo Kick, helped me absolutely fall in love with group exercise when I was in my 20s. And now I have my own fitness business and all that. So you are a big part of my journey here. But when I hear about these weight loss drugs, I have several friends who are on them actually, and they are not going to the gym. They are not doing strength training. They are not doing much more than taking a walk every once in a while because they're actually feeling really lethargic from these drugs. So how important is still doing that exercise and putting in the work?
Well, it's essential. And that's the rub, right? Like, so if we're taking this on as a shortcut and not keeping in the priorities for ourselves, that we've got to prioritize protein intake and developing muscle. So it is muscle that's going to help our metabolism in the long run, not just our metabolism, our brain health, our gut health, our heart health, our bone health, all of those things. Again, it's not the ultimate solution. It could be used as a tool, but we have to prioritize our muscle development. Otherwise, we're going to end up worse than where we started.
All right. And let's switch gears a bit because you also talk a lot about perimenopause and menopause. A lot of women start experiencing these symptoms and don't know where they're coming from. I recently spoke with another women's health advocate, Tamsin Fidel, about it. Let's listen to what she had to say too.
And protecting your bone health and making sure that you're strong going into those years, not skinny. Protein, building up protein, making sure you're making these lifestyle changes are easier to do as you're younger and then going into this. So we're not starting to have the conversation at 45 and 55.
You used to be a cardio queen. I used to be a cardio queen too. I still love cardio somewhat, but really into the strength training as well. How important is strength training? And if you're going for a walk, wear the weighted vest like you've been talking about.
Absolutely. Our muscular system works in conjunction with our skeletal system. And so to add that bone density, number one, improves your cardiovascular system. It also will help you to burn more calories while you are walking. Wearing a weighted vest will help with the bone density. Muscle is the key to longevity. Bottom line, period. And we were so focused as a generation of women on just burning calories, doing high intensity cardio. And we've really got to focus on the thing that's going to help us to age powerfully, and that is muscle.
And one more quick one. There's been a huge war on ultra-processed foods in the last year or so, and now especially with RFK Jr. becoming our Health and Human Services Secretary. You talk about how you have adult ADHD, and you also talk about how you've cleaned up your diet. How has that helped you?
Immeasurably. And I think that's part of the reason why so many people are deficient in GLP, which is GLP-1 is a hormone we produce naturally. I think that our food system has hijacked our body's ability to understand when we're full, to regulate insulin. So to eliminate processed food for everyone should be step one.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.